Hi, everyone. Thank you for joining our Zoom question and answer session. Today, we're going to talk about anxiety and depression. I have some of our team from our Behavioral Health Services Department that is going to be joining for today. My name is Bree Twombly, and I'm the Manager of Trauma-Informed Care at Starfish, and we're really excited that you were able to join us. So if I can just have today's panelists go around and introduce yourselves, that'd be great.
My name is China Cargile. I am an infant mental health therapist. I work with children, pregnant moms and children ages 0 to 6.
My name is Michael Early. I am an outpatient therapist at our Westland office. I predominantly work with children, adolescents, and families. I also work with adults.
I'm Sarah Winslow, and I am an outpatient therapist as well at our Livonia clinic. And I also work with children, adolescents, and families as well.
Awesome. Thank you so much for introducing yourselves. So to get us started, we're going to focus on anxiety for a little while. So China, can you just kind of let us know a little bit about what is anxiety?
Well, anxiety is just basically when an individual or child really internalizes fears and worries, and those fears and worries kind of spill over into other places like school, home, sometimes, play activities or, play dates and things like that.
Awesome. Thank you. So what might be some things that I notice maybe in my child or in myself if I or my child is experiencing anxiety? What would be some things that I notice?
A lot of times with little ones, when they experience anxiety, they have like picky eating, a regression in like toilet training. Sometimes they may have aggressive behaviors. You'll hear a lot of complaining of like stomach aches, excessive crying, and a lot of times trouble sleeping. That's a really big one in the early childhood. A lot of times they have a big regression in sleep patterns.
Yeah, China, I agree with that. I think that oftentimes we'll see a lot of that uncontrollable worry, excessive nervousness, which could interfere with our sleep patterns. We might have a hard time concentrating. We're going to try to avoid that fear, and so sometimes that manifests in like bodily symptoms like the headaches, stomach aches. I will say sometimes I think that the first anxiety disorders that we tend to see in youth will look more like separation anxiety. So children will have a sense of looming fear around being separated from their caregivers or their safety figure. And we also will see some specific phobias in early childhood. So for example, like a fear of heights, insects, a fear of the dark. Well, many youth do often have fears like this to a certain extent. It can become extreme if it's interfering with the child or the family's functioning. And then in like later childhood, we tend to see more generalized anxiety. So frequent worry about a lot of aspects in your life, like your school, friends, family members, world events, your health or safety. And then in this time, I also feel like obsessive-compulsive disorder shows up. So that really has to do with specifically with like intrusive, unwanted, obsessive thoughts or urges that are going to cause a lot of anxiety and a lot of distress for our young ones. And OCD is oftentimes associated with those compulsions or habits that are going to temporarily relieve that anxiety, but will cause a lot of impairments in their daily life. And then I would say for more adolescence to adulthood, we see more social anxiety disorders come up around that time. And so they're more focused on symptoms that are related to like social events, public speaking, meeting new people, and oftentimes in later adolescence, we'll also see more panic attacks occur.
Something that I've also seen some other, indicators of depression, anxiety, excuse me, is that I've seen a lot of kids, like in school, exhibit very much symptoms related, or they seem similar to ADHD. So the child will have difficulty concentrating because their anxieties and worries are so pronounced that they have trouble focusing on their schoolwork, which will then interfere with their, ability to do well in school. And then oftentimes you'll see a child fidgeting a lot and not being able to sit still. They might be, have so much anxiety that it's overwhelming to them to being in the classroom. And this can also be very common in kids with ADHD or autism, which is a manifestation of their anxiety. Eloping as well, you will see. Sometimes the child will elope from the classroom because they're overstimulated and their anxiety is so pronounced that they'll just run. And these are obviously in more, slightly more extreme cases, which, can look like it's very much like a panic attack, that they're experiencing. It can also look into like defiance, difficulty transitioning. They might call home a lot to their parents, and it obviously, like we talked about, it often manifests itself in stomach aches, headaches, just illnesses, period, which when they look at the doctor, they go to the doctor and they find out there's nothing going on with their body, but it's their anxiety that's creating those symptoms.
Mm-hmm. So there's definitely a lot of things to be looking out for. And then it sounds like needing to kind of understand like what is really causing some of these behaviors. Because it sounds like they can look a lot of different ways, but really for anxiety, it's getting that there's some sort of worry that's happening. And that is creating a lot of those behaviors that we're seeing. Thank you all for that. That was some really good information for things for us to kind of be able to look out for what is kind of going on. What may be some signs that we see, or kind of maybe some of those like red flags where we would say, oh, it really seems like this is impacting my child. They may need therapy or some additional support. What would be some of those kind of some signs that we would look out for?
I think a big sign for the early childhood is just this really great or exaggerated excessive fear of being away from their parents or away from their caregivers. That's really big. A really exaggerated fear about different topics like or things and situations such as COVID or dogs or insects or things like that. Basically, when parents' natural ways of soothing their child when they are upset or anxious about something, if those things are not necessarily working as they usually would, that will be definitely a sign. A big one is regression and developmental milestones. You may have children, that were once potty trained that basically go back to pull-ups or Pampers, or you may have a child that's was weaned off the bottle or off of nursing and they need nursing. They need to be nursed or have a bottle or something to soothe them during those times to kind of help cope with those behaviors or those anxious feelings that they have. Another one would be just panic attacks. Like if you notice that your child is just like overly, like a lot of times you hear the symptoms of being dizzy or shaky or just trouble breathing and things like that. That does happen in the early childhood children. So those are just like a few that kind of go hand in hand with the early childhood kiddos.
Yeah, I would agree, China. I think that feeling anxious is a really normal thing for people to experience. We all have anxiety at some capacity. So feeling anxious about a few things some of the time in and of itself is not a disorder. An anxiety disorder happens when there is a significant distress to their functional impairment. So when a child has a severe distress or avoidance to that anxiety provoking situation, and once that starts getting in the way of their day-to-day life or in the way of your family's day-to-day life, I would say then it's likely that your child's anxiety has probably crossed that threshold where it is going to be useful to get professional help or intervention. I think one of the most obvious signs would be if your child is refusing to go to school, and kind of like what Mike had mentioned earlier, anxiety can frequently be misdiagnosed because of the way that it manifests in your bodily symptoms, like a stomach ache. So if your kiddo is oftentimes getting chronic stomach aches and refusing to go to school, that might be a sign. And I like to tell families that other warning signs would be, if you see your child avoiding things that other children are not avoiding, like going to parties or hanging out with friends, or being able to join school groups or sports, that would be a sign. If they don't want to get out of their room and they're spending a lot of time isolated and by themselves and not wanting to interact or be a part of various activities, that might be a time when it would be good to consider intervening.
And also when it creates a safety issue, because as I said, some kids manifest such great anxiety that, they aren't safe for themselves or others. That aggression can happen in some cases of anxiety. Some kids with a lot of anxiety become aggressive due to the fact that, they just don't know how to cope. And if they just don't know how to cope, they just don't know how to handle it, then, I mean, if it's really creating a safety issue, then yes, it definitely needs to be addressed. And like I mentioned, the eloping behaviors too, there's all different kinds. And then functioning in school. So if their grades are slipping because of their anxiety, because like I mentioned, the difficulty with concentrating, if their worries are so pronounced, then it's interfering with their schoolwork, then, I mean, yeah, that definitely would be a good indicator to me.
Awesome. That was really helpful for thinking about some of those things that we can look out for as parents, to be able to know when maybe we should be kind of seeking some additional support for our child to help them cope with their anxiety. Because it definitely seems like those worries can really start to interfere with kind of daily life for them. We're going to move on now to talk a little bit about depression. So Mike is going to get us started by just talking a little bit about what depression is.
So basically, depression is just our body and our mind's difficulty, or almost like an inability to really experience those positive emotions. It's gonna, we can't really perceive things as being happy. We look at mostly everything is perceived in a negative light, and it seems like with our bodies that we're not able to do the things that we used to do because the depression itself is contributing to the lack of motivation. So I mean, it's a chemical imbalance, but also it's a response to depression is also a response to external events. So it could be divorce, it could be domestic violence, trauma, abuse and neglect along with that. There's all kinds of things that can create, and grief and loss, there's all the kinds of things that can then be contributors to the depression. So it's more than just a chemical imbalance, but that is the one part of it.
So it really sounds like there's a lot of connection between like our thoughts and our feelings,
Yep.
Being able to lead to depression. Okay.
Yeah, yep.
Okay. So what are some of those kind of signs that we might see in a child or kind of in ourselves that might make us think that there might be some depression that's happening?
A lot of times in ourselves or in the little ones, you see a lot of irritability. A lot of times you see frequent change in their appetite, whether it's an increase in their appetite or a decrease, irregular sleep patterns, a lot of negative or aggressive behaviors, biting, hitting, scratching, things of that sort. Low energy. A lot of times when you think about the babies that could very well be experiencing depression, you have a child that's really mild mannered, very quiet, no crying, is kind of sitting. Those are a lot of signs that really kind of manifest in little ones. Social withdrawal. I don't want to play with my friends. I don't want to, play with who I usually play with during work time in school or things like that. Excessive crying. Really, a big one is clinginess, when you really want to kind of attach and kind of hold on to your caregiver as much as possible for little ones. And excessive sadness. Like, I'm really sad. I'm crying about pretty much everything. It kind of goes hand in hand with irritability. Like, I've spilled my Cheerios or whatever the case may be, and I'm really sad about it, or I'm really crying about it, and it takes longer for my parent to soothe me than it would normally would.
Yeah, Chuck, I think you hit most of them there. I think that most commonly those are the signs of depression, that depressed mood. If your loved one or yourself, if you notice you start losing interest in things that you normally enjoy doing, that weight change, the changes in the appetite, you might have a hard time thinking and concentrating or making decisions, fatigued every day, having a hard time falling asleep, staying asleep, sleeping too much. You might feel worthless. You might experience reoccurring thoughts of death or suicide as well.
And I think, the other thing that you'll definitely see, as like I've been alluding to earlier, is very similar symptoms to anxiety, since they oftentimes co-occur. One of the things that you will definitely see in a child with depression is they won't be able to concentrate, or they won't be able to complete their work, or they won't have the motivation to complete schoolwork or household chores or anything. They also have difficulty experiencing emotions. So they might have a more restrictive range of emotions, or they might even have mood swings. So that you might see more, rapid change in their moods over time, even over the course of a day. Certain things may set them off. You may also see, especially in boys, some externalizing behaviors. So even though, the child may not be diagnosed with depression, they might exhibit things like aggression or externalizing behaviors, throwing things, just and destructive, just because they have such difficulty coping that, and instead of internalizing, they may get into those externalizing, kind of behaviors. Also, in some of the older kids, you may see some self-medicating. So you might see an increase in drug use, alcohol use, and even a newer addiction, but still around, is video games. So you'll see, it happens to girls too, but see it in boys where they resort to video games as a way to cope with it, and you might see them on it all day long as a form of that withdrawal.
Thank you. And thank you, Mike, for talking about how I think a lot of the times we think of depression as something that is really internalized, something that we kind of like feel and think about inside, but don't necessarily show or have behaviors. So thinking about the ways that it can be externalized too, I think is really helpful for us to know. So what are, again, some of those kind of signs or those red flags that might go up that could be indicators to us that maybe ourselves or our children might need therapy or some additional support to help to cope with the depression?
I think the biggest one is when those negative thoughts and feelings really linger for like an excessive amount of time. When you see those regressions in your normal day-to-day functions, like you're unable to get out of bed, your child is unable to stay in school, they're not sleeping at night, things like that. And then when you are, as the parent to a small child, when a lot of things that you do to really lift their mood and it works, when those things are kind of not working and you really need some help and assistance to kind of move forward so that we can work through and get through, find coping skills for these little ones, those are pretty much like the staple signs that we really look for, like to really start services or get services started.
Yeah, depression, I think, in children often is going to present a lot differently than it does in adults. So while adults with depression tend to look a lot more sad, like we've touched on, children and teens with depression, they're going to look a lot more irritable and angry. So you're going to see those anger issues, defiant issues. You might notice declining grades, physical complaints of the stomach aches, headaches. They might have low motivation or feel a lot more withdrawn. You could see behaviors like running away, low self-esteem, and especially for teens, like Mike had touched on, any use of alcohol or drugs.
So yeah, I definitely agree with Sarah, or China, especially with Sarah, because we're talking about the older kids. You'll definitely see a lot more kind of that self-medicating, when it's self-medicating to a point of they can't function without that other thing that's making them feel better in some way. But the child may also get involved in, because of their depression, they may not even know it, they might get involved in some things that would get them in trouble. So they would wind up getting in trouble at school, or they wind up, even making, maybe for attention, but also sometimes because it's part of their depression, is, suicidal thoughts and threats they may be making. So that's definitely something that if they're doing that, then definitely, if it's a safety issue or if it's a functioning issue, then they definitely need to be in services.
And so Sarah and Mike, I know both of you touched on thinking about like suicide, like talking about suicide, maybe trying to attempt suicide. What are some things that as a parent I would want to kind of be looking out for, or I would maybe want to do immediately if my child was kind of making some suicidal statements?
Yeah, I would say take any mention of suicide seriously. We know that the symptoms of depression include that intense sadness and despair, and oftentimes that comes with thoughts of suicide. So if you feel that someone is in danger, don't hesitate to call 911. Don't hesitate to take them to the emergency room or call the crisis center. You definitely want to take any mention of suicidal ideations or thoughts very seriously.
And I definitely second that with Sarah. You definitely want to take those seriously. And you definitely want to get them to somewhere that's safe. You also want to make sure that if you work with your therapist, that you and or doctor too, that you have a safety plan in place for that child in case something like this were to happen. And then making sure you safety proof the home. So you want to make sure that knives are not around, or anything they can use as weapons, any chemicals, lighters, anything that they could do that could potentially hurt themselves. You definitely want to make sure that those things are not accessible, or medications. Those things are not accessible to the child, no matter if they're really young or if they're a teenager.
Thank you. So if kind of from listening to this or from other things that I might know as a parent, I'm saying like, oh, it really looks like my child does have a lot of anxiety or depression that's happening. It seems like it's really impacting their ability to kind of like feel joyful and do their kind of daily activities. And I do decide to reach out and get treatment for my child. Can you talk a little bit about what treatment would look like for anxiety or depression?
Well, in the little community with the little ones, we do a lot of play therapy. We bring in toys, things of that sort to kind of spark the child's interest. That's how you get them talking. That's their language. A lot of times with the little ones, their language is play. We do a lot of observations, mindfulness practices. I have little ones that love yoga poses and deep breathing and things like that. developmental guidance for the parents to kind of look at and track, the babies and toddlers development together, look at milestones, things of that sort. Emotional support is a really, really big one, because even, you're dealing with a lot at once. So just having somebody there to kind of help validate your feelings and kind of, let you know that, hey, we're here to kind of help. Services are within our program really occur with parent and child. So we kind of need that dyad to kind of work together so that we can find the best practices for mom or caregiver and baby. A lot of times, a big one that we really, 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 really enjoy is just sharing the delightful moments of like new things that's happening within the family. That's really big. So a lot of times, because we are home based, well, we were, but just sharing those big things like, hey, he's walking now, or, they're sitting up on their own, or they're potty trained now. Those are like really big things that we really kind of take into account and really celebrate.
Yeah, I would say for us, a very effective treatment for anxiety is CBT, which is cognitive behavioral therapy. And so in that modality, you're going to be looking at the unhealthy thinking patterns that are going to be creating that anxiety, and we're going to try challenging those thoughts. So we might use exposure therapy as a treatment for anxiety, during which, we would work with the client to create a plan to gradually face some of those anxiety-producing situations, to help diminish those symptoms. You're also going to be learning a lot of coping skills and relaxation skills like deep breathing, progressive muscle relaxation, mindfulness practice. We use all these things to just help relieve folks from symptoms of anxiety. And then, of course, medication can help control uncomfortable feelings of anxiety, and the need for medication varies from case by case.
I think another, besides CBT, I think another focus is definitely, at least with me, is like a strength-based kind of, solution-focused, but strength-based approach to it as well, in addition to that, to really help them understand, especially with depression, that depression is based on, obviously, a lot of negative self-talk. So helping them with the CBT part, creating more positive self-talk, but in addition to that, helping really drawing upon their strengths and helping them see those strengths so that, they can help them with that motivational piece, to work with the child and work with the parent, because, you never know when the child's having those negative thoughts. Are those negative thoughts being reinforced? And what are they being reinforced by? So we're looking at also like, what are some triggers that might be contributing to that? And how can we either minimize those triggers or help them deal with that better?
There's a lot of different things that you are doing in sessions with anxiety or depression. It sounds like, again, we need to focus on kind of like those feelings. What are those feelings that we're having? How are we expressing and showing them, as well as those thoughts? And really for anxiety and depression, I say a lot of how do you start to change those thoughts so they become maybe more helpful in the moment. What about if I am a parent or a caregiver at home? Are there things that I can do when I'm at home with my child to help to support their anxiety or depression?
I think the biggest one is just providing a safe space for emotional talk, like, creating that that dialogue between parent and child to be able to say, hey, I'm feeling this way, can you help me? Really maintaining a positive attitude throughout the situation, that helps a lot. Understanding personal space, because believe it or not, 2-year-olds need personal space. No matter how much, if they say, oh, I just need to take a break. I just need a breather. That's a really big one. And apologizing. Sometimes as parents, we kind of our emotions take over sometimes, and it's okay. Like, we may yell or whatever the case may be, but it's okay to kind of go back and apologize to your child or whoever, to just kind of help, validate, okay, yes, I was wrong, and just really giving them the opportunity to have that kind of strengthen that relationship and that safe space between them.
Yeah, I agree, China. I think that especially with depression, first and foremost, I always like to frame it for families that, depression isn't an attitude, it is an illness. And so a person who is feeling achingly sad cannot just cheer up. If they're feeling lethargic and fatigued, they're not going to be able to just go exercise. They can't just see the glass half full. So I think that the more understanding we have on how truly debilitating depression can be for people, the more compassion and patience you're going to have with your loved one. And I know that being around a person who's depressed can be, undeniably draining. And family members, I think, naturally want depression to end, but sometimes your loved ones will hear that desire for the depression to end as quickly as possible as just like another way that you don't understand how debilitating that experience is for them. And so sometimes we hear commonly the sentiment of, why are you so depressed? You have so much to be grateful for. And I think that that comes from loved ones that are, of course, very concerned, but also don't understand that depression has, no more to do with ingratitude than any other illness would. You just want to be really careful about what you're communicating to your loved ones, verbally or non-verbally. You don't want them to feel that you think that their feelings are irrational or overblown, because that's just going to prevent them from wanting to be able to talk to you. And depression and anxiety can be really isolating. And so that can be a really dangerous place to be if they don't feel comfortable enough to talk with you about things. So first and foremost, I would say just recognizing that it is an illness. Make a point to reach out to your loved ones. People with depression do isolate themselves and they fall out of touch with their loved ones. So, consistently providing that support and emphasizing your support is going to be really helpful. Offer to take them to appointments. Offer to help find a provider. Encourage any, healthy habits they are engaging in, like exercising, socializing, eating healthy. Again, taking any of that mention of suicide really seriously. And also, I think that loved ones need to be reminded that they need to take time for themselves and take care of themselves, because supporting someone that has depression can be so frustrating, so tiring, so emotionally draining, that it's okay to take a break for yourself and make sure that you're getting adequate sleep, that you're getting, exercise, and taking time for yourself as well.
And the other thing that I think you could definitely help support your child is making sure you have a safe place in your home for them when they're experiencing a depressive episode, or they just need a break, that you're creating that within the home, that atmosphere, that environment, and that you're also, as a parent, modeling healthy coping skills with them. I know that can be difficult sometimes, obviously, because, sometimes parents also experience depression. So, but definitely getting help for yourself if you're experiencing those things can be very beneficial for your child as well.
Great, thank you for sharing all of those. Those are some great tips for us to start thinking about how we can use some of those things at home. If I am a parent or maybe I am a teen or adolescent who's watching right now, and I say, like, I do want to reach out for services, I think therapy could be really helpful for me. How would I get in touch with Starfish right now?
Yeah, so you can call our intake department at 888-355-5433. And just know that we have locations in clinics in Livonia, Inkster, and Westland as well.
Okay. And right now, are you seeing people in clinics, or is it looking a little different because of COVID?
That's a good point. So right now, because of COVID, we've been doing telehealth services only. So that's going to just look very much like this. We'll be doing video chats with you, checking in through phone calls, video chats, until we can finally get back into offices and see each other face to face. But we're still taking new clients, and you can still get in and get services.
Wonderful. So before I kind of close and thank you all for your time, is there any kind of last thoughts that you have around kind of anxiety or depression that you would like to share with any of the folks who are watching?
I think the biggest thing I would like to share is that, you know, it's something that a lot of people experience. So I think it's definitely good as a, you know, parent to definitely, you know, advocate for your child and educate people and let them know that, you know, if your child's having some difficulties, that it's not like with teachers, for instance, it's not because of a lack of ability sometimes, or it's not of a lack of intelligence, but that, you know, it takes a community to help out. And a child who feels like they have a bunch of people around them that are supporting them, you know, increasing their support circle is definitely, you know, a way to really help them.
Okay, well, thank you. All of you were so helpful and shared so much great information today. So thank you to China, to Sarah, and Mike for all the information that you shared with us today. And thank you to all of you who joined and took the time to watch this. And please give us a call at Starfish if we can be of support to you and your family. Take care and stay safe.
Thank you.